to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. I'm your host, Rhonda Alford, and joining us on today's episode is Erica Ordoyne and Kate Baumann, both nurse practitioners at Terrebonne General Internal Medicine Specialists. Welcome to the show, ladies.
Thank you.
Well, let's get started with you telling us a little bit more about yourselves and your roles at Terrebonne General.
I have been at Terrebonne General since 2007. When I started, it was the emergency department, and I was a patient access rep for about 6 months, and then I was a patient care tech, and then I later went back to school and became an RN, and I worked as a staff nurse, charge nurse, clinical coordinator there. And then I kind of did some education with heart failure, and then I went back to the ER at one point, and then I went back to school, and I became a nurse practitioner.
Oh, so you literally worked your way all through Terrebonne General.
All the way.
All right, and Kate?
I have been in healthcare. This is year 18 for me. I was an LPN, and then I went back to school full-time while I worked and finished my RN, and I worked all through med-surg, emergency department. I've been a staff nurse, charge nurse, educator as well, but the main part of my career was in ER or ICU, and I am now a nurse practitioner, been here for a year, and it's been great being here.
Both of you combined have seen a lot, I am sure.
Yes.
So very experienced. So let's get into today's conversation about chronic illnesses. Eric, can you tell us what is the difference between a chronic illness and just a regular illness?
So a chronic illness is an illness that is typically a year and longer, and it is progressive. We have to continue to treat it. It's not like an acute illness such as the flu, that it typically only lasts for 7 to 10 days. This is continuing on.
And what are the most common chronic illnesses that you treat?
I think the most chronic ones that we see in internal medicine, and Kate will probably agree, are hypertension, diabetes, hyperlipidemia. Osteoarthritis is one that I see a lot, and then depression.
So those are all things that need to be treated, obviously. Why is developing an ongoing relationship with a practitioner so important, Kate?
One of the biggest things that I feel like patients get is a good rapport, but that way you can build on it and see like where you were in the past and where you've gotten to at this point in the treatment course, and knowing what your good days and bad days are, and getting a good relationship with your practitioner is great to be able to know those minute changes in your chronic illness that can happen and can worsen your chronic illness.
And why is it important to get an early diagnosis when you're treating things such as diabetes and hypertension?
So one of the biggest things is getting diagnosed young or early on in the process, so you don't have complications later, kidney problems, limb problems, heart attacks, things like that that can stem from something as simple as just high blood pressure.
So it's important to get those screenings done that can help detect these things. And Erica, what lifestyle changes can have the biggest impact on improving and controlling chronic illnesses?
So I think the biggest lifestyle changes, as always, is healthy eating. Diet, exercise at least 150 minutes per week, smoking, stop smoking, and that's pretty much the biggest ones.
How can patients partner with their healthcare practitioners to stay on track with their treatments?
So yearly exams is great. You can see any subtle changes that may have happened in your blood pressure, or if you know that you go to a certain pharmacy or a certain store or even the gym, you can get your blood pressure checked and see and let them know and communicate back to them this was a change. And then making sure that you have yearly lab exams that are done, and then making sure that there's any specialists that you need to see, that you are up to date with those as well.
Erica, what advice do you give to patients that might feel a little overwhelmed with a chronic illness?
It's step by step. So start with one step and then go to the next. Make small goals. Don't try to conquer it all at once.
Right, take it day by day, right? Okay, and you mentioned, regular checkups. And how does medication and taking your prescribed medication help with managing chronic illnesses?
So one of the biggest things that I always tell my patients is we're going to pick medicines that are going to work for you, but also what works with you. So if you know that it's a medicine that you have to take twice a day, but there's an option that's a once a day, and you know you're going to remember something once a day, then let's try to figure that option out instead. And getting to where you are also part of the healthcare decision, not just something that, oh, I know this medicine is going to work, you're going to do this. No, it needs to be a dialogue, and it needs to be something that's going to work with you, but for you, and get you better to where you can go about your day-to-day things.
Right. That way they can be consistent, because taking medication is very important with controlling chronic illnesses, correct? All right. And Erica, what are some warning signs that a chronic condition may worsen, or, what should prompt someone to go ahead and pick up the phone and give you a call?
So, of course, weight changes, increased weight or decreased weight, swelling, chest pain, shortness of breath, a headache that you can't get rid of with Tylenol, Motrin. Those are all signs that you need to call your healthcare provider.
And Kate, how do you work with other healthcare specialists to manage these chronic illnesses?
One of the great things about Terrebonne General is there are a lot of specialty physicians and practitioners here. And so through Epic, we can communicate. I can see a patient and send their chart notes over and say, I saw this patient that's a mutual patient of ours. This is what they mentioned to me, and it's not necessarily something that needs to be taken care of today, but at their next visit with you, I just want you to be aware of that they mentioned it to me now, and that way you can discuss it with them later. And it's just great to be able to have that communication back and forth with other specialty providers.
Right, and it's at your fingertips, and the communication is just an open line of communication.
Yep.
Erica, what tools or resources would you recommend to help patients manage their conditions?
A blood pressure cuff at home, glucose monitoring. They need the meter at home, a scale. Just check your weight every day. And then an app, tracking apps to keep track of your weight, your blood pressure, or even what you're eating every day.
So just being aware of all these things can help maintain a healthy lifestyle. What is one piece of advice you would give someone, and I ask both of y'all this, living with a chronic disease, and how they can maintain their quality of life?
One of the biggest things is knowing what your baseline is and being open and honest with your practitioner. If you are having these subtle changes every day and it's becoming a bothersome thing, reach out. It's not something that we ever don't want to hear about.
Right.
We want to know if there's changes. That way we can get you feeling your best so you can get back to your everyday. If you're having to call in sick once a week, that's not fair to you. That's not fair to your everyday life. You need to get back to that. And if it's something that we can help control with a different stretch, if it's a new back pain or if you're having knee pain, but it's not to the point where you need to have any procedure yet, maybe there's just a subtle change that we can make in your lifestyle or in stretching, exercise, anything like that can be taken care of right then and there. But being open and honest is a huge, huge part of it.
That open line of communication.
Yeah.
And that's where my chart helps a lot too, because you can just message your practitioner and, it's like almost real time. I mean, you do follow up in a certain amount of time. That way they can get a pretty prompt answer, get a medication filled if they need it, and all these things.
Yeah, I have dialogues back and forth every day with patients. It's something that I really enjoy, and I can send results back and forth that are not something that we need to talk about over the phone. Like if they had their yearly checkup and they had their blood work done, I can send a message saying, this is your results, these are the changes that we need to make, or no changes need to be made, but you're doing a great job and continue the good work.
Right. And I mean, some people might be afraid of getting on the computer, but it's really easy.
It's very, very simple.
And then we have assistants here at the hospital.
Yes, she's
at
wonderful to
Connect
help.
Bar, Vicki can help get anybody signed up. So, and they're right there on the first floor when they're coming down.
I send them down all the time.
Go see Miss Vicki. She will help you, and then we can connect.
She's more than willing. Well, Erica, what about you? What is the one piece of advice you would give to people, living with a chronic disease? Sometimes it can be scary getting a diagnosis, but
I kind of almost the same as Kate. I tell patients all the time, when we start this, if you don't tell me, I don't know. You have to call me. You have to follow up. You have to call the clinic. Let us know what's going on. That way we can get you in. Don't think that we're not going to, because we're going to try every which way to get you in to see us.
Right. It's all about the relationship, right? And I know internal medicine and family medicine kind of go hand in hand, and they're a little bit different. Can y'all kind of explain what the difference is in the types of patients that you treat?
So family medicine is from birth to death. And so they see all different ranges. And so in internal medicine, we see
more of the older population, but also people that have those chronic illnesses that also stem into other illnesses that need to be managed a little bit more carefully, a little bit more closely. So I have a lot of patients that I see every 3 months. There are patients that see other physicians that they are in there every 6 weeks. So it's more of something that is a little bit of a closer monitoring in internal medicine as a specialty as a whole. And like she said, with family practice, it's a little bit more as an overall care, and you might see them once or twice a year as opposed to several times a year.
And so it's more of a specialty, the internal medicine. Okay. What is a chronic illness that people might think is very difficult but surprisingly easy to manage? Can y'all think of?
That's a good one. I would almost say high blood pressure. Like, it's manageable. You can do it. And hyperlipidemia, we can treat it. We can get that fixed.
And what's the most common treatment for that?
So typically we start with a statin drug, and then if you're good on the statin, you stay on the statin. If not, we can add something if some people can't tolerate statins. And then there's other drugs that we can add, such as Repatha. A lot of times cardiology takes on that part, but that's where we phone a friend and send them over.
Yeah, when it gets past a certain point. Do you all do wellness visits with your patients?
Oh, yes. I actually did one earlier today. Most of the time, insurances will remind you it's time for your yearly checkup. And to me, a wellness exam is something that we're not focusing on a certain chronic illness that you have. A lot of patients that I see, we're focusing on controlling that blood sugar, making sure that any dietary or medication changes we made at the last visit 3 months ago, did it help? Did it improve your A1C? Did it improve your fasting sugar? Or is it something that we need to continue to work on? At a wellness exam, I can look over and make sure, are all of your medicines absolutely correct? My nurse, Tamika, she goes through everything perfectly and goes through all of the bottles with the patients to make sure that the dose, everything, any specialist that they've seen, everything's up to date. That way we have a good, well-developed picture of the patient, making sure that all of their needs are met in that visit to make sure that we're not missing anything. Because when you're focusing on your blood sugars at a regular visit, you might forget, oh, I forgot to tell her about my toe that's been bothering me for a year. I need to get that checked to make sure I don't have gout. But it's not necessarily something that's on their mind in that moment, but it's something that we can go head to toe and make sure we don't miss anything.
So very important wellness visits.
Yes.
All right, well, thank you, ladies, for sharing all this helpful information with us today. We appreciate you being on.
Thank you so much for having us.
For more information about internal medicine specialists, visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get your podcast. Thanks for joining us.